Good afternoon, everyone. Hello. We're all ready? Excellent. So my name's Dr. Hubbard. I'm a GP. One would describe me as a portfolio GP. So I do various things. I've been an expedition doctor. I've been a locum. I've worked in A&E, sort of a varied career. I've also been a marine biologist, and I've interestingly worked in law and various other things. So my remit today is to talk about cardiovascular disease. It's a big topic, and it's a really important one. So I'm just sort of going to briefly talk about why I got into nutrition and health, sort of a bit about the size of the problem of cardiovascular disease. And then most of it will be looking at the kind of evidence base for what we can do, the sort of whole food plant-based bit of it. A couple of definitions, some of the stuff we've probably been over already. If anyone wants to go and watch the football, all you have to know is whole food plant-based. That's about it. So feel free to go. I won't be offended. Anyone who wants to stay, then do stay. So the case study. Most of us, all the doctors, we often have patients, individual patients who interest us, who kind of inspire us in some way. And I definitely have one who's really sort of taken, my interest in nutrition. It's a chap I've been involved in his care for many, many years. And he has a condition called ankylosing spondylitis, which interestingly, like Kate, it's part of the rheumatology diseases. It's a form of rheumatoid arthritis. And its typical presentations are pain. It's a back pain and kind of hip problem. So it's pain, it's fatigue. You get extra symptoms like the iritis that Kate spoke about. And it's one of those things. It tends to be progressive. You end up often people end up without being able to move their spine at all. So they have a kind of a fixed spine, and to turn you have to move all as one movement. So this chap, early 20s, low back pain, saw his GP, nothing particular. Family history of ankylosing spondylitis, so it was kind of thought that may be what it was. And he managed it, as a lot of young people do, with exercise, because rest made it worse. So tended to be quite fit, a lot of exercise, a lot of activity. Managed it with over-the-counter medication, Nurofen, paracetamol, that kind of thing. Was offered other sort of more heavy-duty drugs, but didn't feel like they were necessary at that point. In his early 30s. Extreme fatigue, he thought maybe it's because I'm working hard, maybe I'm just getting older, I'm 30, is that why I'm so tired? He suffered iritis, this severe eye pain. And then somewhere, 33, 34, came across a book called The China Study. I started looking at that, reading that, and it seemed to make sense. Now, interestingly, he wasn't interested in it from a perspective of his ankylosing spondylitis. He was just interested in it from a broader health perspective. Some family members have had cancer, and so he was kind of just interested in the whole idea of it. And over a couple of years, went from being what he thought was a healthy kind of omnivore to whole food plant-based. And as a side effect of that, if that could be the right word, his back pain disappeared, his flexibility seemed to improve, his fatigue just went. He felt fitter, healthier, more active than he'd been. So now he was sort of in his mid-30s, he felt as good as he did in his early 20s, which was amazing. And I guess some of you may have guessed already, some of you already know. Obviously that patient is me, so that's my story, that's my history. So, and I was saying to Kate just at the break, it's really hard to convey how wonderful it is if you're in chronic pain for it to go. I mean, it's just like, you can see the smile. I mean, you can't get that, you can't really grasp that until you've experienced it. And it's just wonderful. And for me, so I've had one flare now in maybe 5 or 6 years. Interesting, my rheumatologist back in Ireland still insists I should go on medication. We've agreed to disagree, you know, and I've actually been discharged from the clinic, and she said, look, I'm enough already. Like, if you want anything, if you want my help, come back, there's an open door, but otherwise you seem to be managing well. And the physio discharged me too, so that was, you know, from that perspective. So that's kind of my background, why I got interested in it. And, you know, I read the research, I looked at all the studies. I'm a GP, I started looking at, you know, the evidence for all the other diseases, and realised, again, so referring to what Shireen said, in the sense, you know, it seems like there are very few downsides to a whole food plant-based diet. So it's kind of like the risks are low. So it's not like methotrexate where you have to blood test all the time. You know, you don't have to carry a book. You don't have to become friends with your phlebotomist. It's more that you can take a chance on it, and you don't have to necessarily have 100% evidence, because there doesn't seem to be, you know, as I think Connor or someone said earlier in the discussions, nobody's going to say anything to you if you just eat more plants, really. So I think it was something that I felt comfortable with as a GP, saying, look, you can try this, see how it goes. You're unlikely to cause any major harm. However, there is a lot of evidence out there too. So some people may or may not have heard of what was called a moonshot. So we're talking about non-communicable disease, which is the things we've been discussing today. And the moonshot is the high-tech, the stem cells, the drugs, the kind of the sort of advanced, you know, the AI algorithms, the advanced approach. And the ground shot is something that the Lancet proposed earlier this year, which is something that we can do now that isn't high-tech, that you know, it's something that is evidence-based and it is cost-effective and it does work. So we've got science to support it. And that will be what we're talking about, this kind of non-communicable disease treatment with a whole food plant-based diet. So just briefly, non-communicable diseases, we sort of refer to them as chronic diseases, long duration, the result of combinations of genetics. So we know genetics are involved, but it's a much smaller part than we sort of, maybe the general public think. Physiological, environmental, so that's your toxins, your pesticides that people have spoken about. Behavioural, again, that's your lack of exercise and things like that. So again, definition of a whole food plant-based diet. We've had it already. I suppose what I'd like to make clear, and the terms are used slightly interchangeably within the research as well, is the difference between vegan and whole food plant-based. So vegan is very definitely, and I would propose it's definitely an ethical viewpoint. It's a perspective. It's an ideology. It's a way of living, but it's not necessarily healthy. So you can have a vegan diet that consists of Coca-Cola and crisps, but you're not going to be healthy. So this is kind of perhaps where some of the preconceptions of people are of the unhealthy vegan, you know, from back in the day when people were much more likely to be ethical vegans. They might not have paid much attention to their diet per se, because that wasn't why they were doing it. So what we're talking about for health is always the whole foods plant-based diet bit. So vegan is a separate thing in of itself. So this is just a definition that I found useful. You know, it emphasizes legumes, whole grains, vegetables, fruits, nuts, seeds, and it discourages most or all animal products. And I suppose one of the things that we've sort of touched on already, the key components seem to be the animal protein and saturated fat. Again, as it says, mostly comes from animal products. And the carbohydrates, so they whole grains. Is it a whole product or is it refined? Again, Shireen touched on that with the BMJ article, looking at refined things. This actually is about diabetes, but just gives an illustration. This is 2016, where we're looking at the healthful plant-based diets, unhealthful plant-based diets, and then just generic plant-based diets, whatever that means. And you can see from the graph, it appears that if you eat an unhealthful diet, you're potentially at slightly more risk of developing diabetes than if you eat the healthful plant-based diet, and then the the sort of generic one is somewhere in between. It just illustrates what I mean about it's not all just not eating animal products isn't always necessarily healthy in of itself. So cardiovascular disease, that's what we're talking about, or what I'm talking about today. And it's a kind of an overarching term. It's a group of things. So it's high blood pressure, it's heart disease, it's strokes, peripheral vascular disease. So as it says, it's diseases of the peripheral vascular, so the blood systems at the edges, heart failure, rheumatic heart disease, congenital heart disease, cardiomyopathies. So it encompasses a whole sort of range of different conditions. And Shireen said that cancer is the #1 cause of death in the UK. Cardiovascular disease is the #1 cause globally. So it's a huge problem. We're talking 17.3 million estimated to die in 2008, roughly 30% of all deaths. And we're talking mostly it's heart disease, followed by stroke would be the big ones. This data comes from the World Health Organization. So just looking at the UK, and these are deaths under 75. So again, we can see the cancer there, 37%. This is in men. Cardiovascular disease, nearly 25%, with heart disease being the main one, stroke coming in at second. Something that's interesting is you might go, well, people have to die of something, so maybe we just say they die of cardiovascular disease. But we actually consider deaths under 75 as premature. So these are all deaths that we consider unnecessary or premature deaths. Again, this is women. Heart disease has a slightly less of a role. Cancer is slightly bigger of a role in women in the UK. This is UK figures. So this slide isn't really to go through the details of it. It's just to kind of say, this is some of the evidence. So these are large population studies looking at the consumption of animal proteins, animal products, and they're just essentially saying they're increased with mortality, atherosclerotic cardiovascular disease. Atherosclerosis is the hardening of the arteries. So we've got 2009, 10 years, I think over the last 10 years. This is 500,000 people, so a big study. This is a meta-analysis, so looking at lots of studies together. So it's this is 2017. This is new studies. This is a good article in JAMA, which is a well-respected research paper. So there's a lot of evidence out there. So despite me saying we don't need high-quality evidence, there actually appears to be a lot of evidence there that a whole food plant-based diet is what we need to be looking at. So in terms of cardiovascular disease, it's actually, although we think we know what causes it, or it seems like we know, it's actually quite debated, and these are the mechanisms that have been proposed, and they're all sort of, all these articles say that it's a combination. I think we can probably agree it's a combination of lots of different things. So this is, your saturated fat consumption, which comes from animal products, salt intake. We know salt increases your blood pressure. Obviously, a small amount of iodide salt might be acceptable, as we heard earlier, but increased inflammation. I mean, this is an interesting one in terms of inflammation and the inflammatory response. I was listening to someone talking about this earlier. So it seems that animal products or certain processed foods can cause inflammation in the body. And the body's great at repairing itself. It's really good it's very effective at that. But what we tend to do is we tend to eat 3 times a day, 5 times a day, maybe as Alan said earlier, and we're not giving ourselves a chance to repair. So it kind of sort of the people I heard talking about earlier today was suggesting, if you're going to smoke cigarettes, you're probably better off smoking your year's supply, in a day, really going for it, and then having the rest of the time to recover. You're giving yourself time to repair. And the similar thing, if you want to feast at Christmas and Easter, on unhealthy foods, but give the rest of the time for your body to recover, then you're probably doing. It's probably much better. That's the inflammation thing. It's like they say people worry about what they eat between Christmas and New Year. Well, really, you should worry about what you eat between New Year and Christmas, and then it doesn't matter so much. Other reasons: high cholesterol, high blood pressure, diabetes, which we've heard about. These are sort of newish postulations. So this is back to the gut microbiome, linked to atherosclerosis. Again, these are theories. We don't have, the further you look into it, the more sort of complex it becomes. So these are all like postulated ideas, and I think, like I said, there's a combination. Endothelial dysfunction again, causing plaque buildups. TMAO. I just thought this was interesting. So this is from 2 pharmacology research papers. So this is what they said in their conclusion. So until recently, the underlying cause of atherosclerotic cardiovascular disease remained unknown, although a potential dietary cause was suggested by the fact that vegetarians, and especially vegans, have a much lower incidence of atherosclerotic cardiovascular disease than animal flesh eaters. So what did they suggest? Did they say, well, maybe we should just eat less animals? Or maybe we should develop a broad-spectrum bacterial lysase inhibitor so we can medicate people and they can continue to eat their animals. So again, this is just another saying, another pharmacology paper saying that if you don't eat animal products, you don't have so much TMAO, you're less likely to get cardiovascular disease. And then I just thought, again, I'm really just covering a few of the big studies just so people can see. We've heard it a lot, and the message is actually quite simple. It really is: eat whole foods, eat mostly plants. And if you're getting your 10 portions of fruit and veg a day, you can argue around the edges about your small amounts of olive oil and all of the other the things that people get caught up on. But really get the basics right. Get those right first. So I just thought I'd just cover a few sort of the new recent studies and the big papers. So this was looking at 86 cross-sectional and 10 cohort prospective studies. So this was a review, a meta-analysis. And they suggested that a vegetarian diet could decrease the incidence and or mortality from ischemic heart disease by about 25%. So, they're pretty big numbers. I'm not sure whether this has been published yet. This is an article Shireen sent me. And again, this is just another review article, and its conclusions. Strong and consistent evidence from multiple clinical trials and observational studies supports the beneficial effects of vegetarian dietary patterns for cardiovascular disease. So we're seeing it in multiple places from multiple study groups looking at the data that's published. So again, Gemma mentioned, where's this, who's funding the studies? And again, this gets really complicated, and I'm actually coming across lots of studies now funded by the Walnut Association and the Avocado Board and things. So it's getting very complicated. However, despite our potential concern about who's funded the studies, is it big pharma, who is it, dairy, what are the industries, we're still seeing the published literature being reviewed and saying, vegetarian, whole food, plant-based diets are still effective. So, I think that just goes to support the evidence for it, really. So again, we're talking well-planned vegetarian, so that's your whole food, plant-based diets. This was another interesting one, fresh fruit consumption. So this was in China. I think this is, 500,000 people, aged between 30 and 80 roughly, from 10 different parts of China. So we're getting a nice broad mix, and 3.2 million person years of follow-up. So we're talking a lot of data here. And again, they showed if you eat more fruit, you're gonna have significantly lower risks of major cardiovascular disease. They did the same study actually, and they looked at diabetes, the same sort of study population, and increased fruit consumption reduce your risk of diabetes as well in the same study population. This is just from one of the review papers, just sort of trying to illustrate the confusion, potential confusion that's out there and what we sort of think we know. So we've got evidence of harm, so you limit it or avoid it. Inconclusive evidence, so we're not quite sure, and then recommended. And even on this slide, we've got olive oil, which we've already heard today is potentially not recommended because of the design of the studies, as Connor said. So it can be a bit difficult to tease things out. I think the coconut oil, the eggs, the juicing, we know added fats, oils, fried fruits. I think pretty much everyone's agreed on that. I'm surprised that the antioxidant supplements is in the inconclusive. I think we just don't really know, so nobody's really recommending them. And again, the gluten, I think pretty much people are really coming down on, if you don't have a gluten-related disease, then, don't worry about it, kind of thing. But the evidence of benefit, we've got berries, we've got nuts, we've got leafy greens, we've got plant proteins. So we've got, the standard whole food plant-based foods that we've heard. And now in terms of a sort of population, what can we do about it? So how do we treat it? How do we approach this? So there's what we've been doing, which is targeting high-risk patients on an individual basis. So that, what we mean by that is you're taking someone, maybe they're in a GP practice, they're in front of you, they've got high blood pressure, maybe their cholesterol's a bit high, you give them a statin, you give them an ACE inhibitor, you give them a beta blocker, you're kind of treating them with medications, and you're treating them as sort of on an individual basis. That's kind of what we mean by high-risk patients. Or we can try and lower the risk on a population scale. So that's where we sort of change people's perception, change people's diets, or change the population. So you only need a relatively small change there to have a big impact. And this is what I think this was a 2004 paper, was saying, that we need a population-wide approach. So if we can reduce 10% reduction in your average of blood cholesterol and blood pressure, we can reduce major cardiovascular disease by 40%, 45% even. So, and these are the sort of things, going back to what we said about the ground shot, what can we do now? What can we change? And this is sort of part of what this forum's about, is we've got the evidence, eat whole food plant-based. If we did that on a population level, we'd have a huge impact or potential. We're saying, this is another paper saying that it's largely preventable, but radical policies will be needed to further improve diet and reduce smoking. So again, things like the smoking bans have had a big impact, and it's about whether we can make changes like this, whether there's political will. I know Shireen said she felt this is going to be a ground-up movement, but I think potentially ground-up and top-down is the best approach if we can muster that. So yeah, the first quote was from 2004, and then this is a 2015. The one looking at the future was modelling future coronary heart disease mortality to 2030 in the British Isles, where they're saying we need to make big changes. But it's not new. So back in 1999, this is Oxford, University of Oxford Imperial Cancer Research Fund. So this is standard researcher stuff. Good quality university. They said the evidence available suggests that a widespread adoption of a vegetarian diet could prevent approximately 40,000 deaths from ischemic heart disease in Britain each year. That's since 1999 we've been saying that. And the papers that I published there showed there were 2015, so we're still saying the same thing. So somewhere we're not quite getting the message through. Sandeep mentioned this, when to start. How early, do I start when I'm 65? Retire and start on a whole food plant-based diet? Do you do it maybe at 50? Or is it 40? Is that, is 30 the new 40? Maybe 30 is when I should start preventing it. So this is the title of a paper that came out April 2018. research is linked to Great Ormond Street Hospital and some of the London universities. Again, these are, Great Ormond Street. Hands up, who's heard of Great Ormond Street? Yeah, exactly. Mainstream. We're not talking small, places. This is mainstream stuff. Plant-based diets for children as a means of improving adult cardiometabolic health. So it's not saying do plant-based diets. It's not saying should we. It's saying it's just a statement. And just picking a few of their sort of conclusions, but essentially it seems that cardiometabolic risk factors in early life are linked to cardiometabolic risk factors later. So, and we're showing, certainly in America, the evidence of atherosclerosis in children, and this sort of classic studies where the autopsies in Korea, so the Korean War, we took soldiers whose average age was 22, and they had signs, these is fit young men, had signs of atherosclerosis. They did it in Vietnam, some people of a certain age will remember their average age as being 19. They also had evidence of atherosclerosis. So we've known for a long time, and I was at a talk by a chap who works in Dublin. He's into exercise, but he was doing scans of necks, arteries, carotid arteries in children. And he was seeing evidence of aging in children in Ireland as well. So this isn't an American thing, because I think some of us, personally, I've often thought, well, America's slightly different, but there's definitely evidence over here too. And again, this is a conclusion from that paper. If applied to children, if a plant-based diet is applied in children, they could potentially offer cardiometabolic health benefits through the reduction of cardiovascular disease risk beginning in early life. So these are the kind of things, the sort of the public health things that we need to start thinking about. No talk about cardiovascular health would be complete without Dr. Esselstyn's wonderful work from 1995. This is, for some people, these are the images that really capture it, that really get people and sort of send them off down this line. So these are coronary arteries. You can see the white is blood flow. So imagine it's kind of like a river. And then this is nice fat flowing river, and then it gets narrow is almost kind of choked up there, all the way down here. Now this is the same artery. This is 32 months later of a plant-based diet without cholesterol-lowering medication. So there's no drugs involved in this one, although some of them he does use it. And you can see this is a reversal. I mean, you can see how fat it is all the way down. There's no other major changes other than diet. These were the first sort of real kind of hard evidence that we could really make a difference. This is another slide. These ones, they did use some statins, cholesterol-lowering medication, but we're still getting a significant improvement. You see the narrowing there and the fattening here. And again, narrow here, and then nice and fat. So we're getting improvement. Again, so the last two slides, they did use statins as well. So the general advice, I suppose, we're talking, so in terms of diets and things, don't just eat, like someone said earlier about eating a plentiful diet. You don't want it to be restricted. I think it was Luke who said he wanted to be able to eat lots of food. So don't eat small portions of disease-promoting food. Eat large portions of the health-promoting foods. And there is general agreement that a plant-based diet is beneficial. There's no question. We had the question about, what do we recommend in terms of diet? We don't want to go against guidelines, but the Eat Well plate in the UK says eat more beans, eat less meat. That's what we've heard from everyone so far. So there is general agreement. It's eat more fruits and vegetables, eat more whole grains, eat less processed food. The sugar-sweetened beverages have been touched upon today as well. I mean, again, another big factor. There is discussion. I mean, we've seen already there is some discussion around the edges, a little bit here, a little bit there. But I think, again, that's a bit like the sort of, if we get the main picture right, then you can go as deep as you like into fine-tuning it. If you're an elite athlete, you can time your protein exactly. You can, have different types. But really, it's about getting your vast majority of your food from plants, whole food, plant-based, nuts, seeds, beans, pulses, legumes, all that kind of thing. Again, yeah, so that's what I'm saying. Low saturated fat, I think we can all agree. I think that's pretty general. And reduce or stop red meat and processed meat. Again, that's pretty much universal. Is the red meat and the processed meat is harmful. So this is just last two kind of papers to sort of sum it up. So this was from Harvard in 2018. So brand new. And they're saying a healthful plant-based diet should be recommended as an environmentally sustainable dietary option for improved cardiovascular health. And I like this, environmentally sustainable. That's something we haven't touched on particularly, but I think it's really important. You know, as doctors potentially, or as healthcare professionals and as people, one of the biggest impacts on global health is going to be climate change. You know, we're in the midst of a heat wave now. It's great, loving it. Add that a little bit longer, and we start getting water shortages. We start having problems with, other problems. Other problems. So we're going to see environmental change causing health problems to individuals. So it's kind of hard to picture it, but it's going to happen. So I think it's really important to take note of where our food comes from and make sure that it is as environmentally sustainable as possible. So it's nice to see that that's mentioned. It's not very often. So doctors tend to like to put things in boxes and say, this is this and this is this, and not connect them up. But I think we do need to. This is just another one, 2017, from across the pond. This is in Italy. Again, echoing the same thing. Maximize the consumption of whole grains, vegetables, fruits, legumes, discourage the consumption of meat and meat products, as well as refined and processed food. Plant-based diets fully meet these criteria. And the evidence supporting the protective effect of these dietary patterns evolved rapidly in recent years. There's something you may have noticed, like a lot of these papers that I'm showing, I think the earliest, they're all happening, in the last 20 years or so. We've known about this for longer, but there's a lot of research coming out at the moment. Don't forget, smoking in terms of cardiovascular disease, classic. I mean, it goes without saying, don't smoke, or if you're going to do it all in one day in that year. Exercise, again, really important. We've talked about it in cancer prevention. Equally, it's really important in cardiovascular disease too. So remember to exercise. And we've heard it. It's not specifically with cardiovascular disease, but B12. Pay attention. If you're not eating animal products, and if you are, just make sure you've got a regular source. Your levels are checked. It's just so simple, and it's just one of those ones that we must remember. This was interesting. Now, it doesn't really project very well. This is Global Health Metrics from the Lancet 2017. This is looking at disability-adjusted life years. So this isn't just death, but this is time living with disease. And the slides, when I put them up, you'll see they're really messy and they're a bit too small for this screen. But hopefully I'll be able to read it. And it's just showing what we're doing that causes disability and death. So as you can see, it's a bit messy, but this is for men. And in 2016, the leading cause of disability-adjusted life years is smoking, followed by high blood pressure. Now, we know that blood pressure is affected by diet. And what else have we got? We've got cholesterol somewhere down here, cholesterol. We've got high body mass index here. We've got blood glucose. Further down the line, we have things like low fiber down in the 20s, low fiber, low physical activity, which we mentioned, low vegetables. So just simply number 19, the number 19 cause of disability-adjusted life years in 2016 is simply not eating enough vegetables. Number 11 or 12, not eating enough fruit. 11 is not enough fruit. 12 is not enough whole grains. And these are, this is quite amazing that these are such simple things in today's society. I mean, we can all. I mean, certainly where we live, we've all got access to all these things, and we can make big changes. In women, it's again high blood pressure, high body mass index, high blood sugars, cholesterol. What else have we got? Whole grains, number 12. Fruit at number 15. Nuts and seeds at number 17. Too much salt, number 18. Low vegetables down in the 20s. Physical exercise there, 24. So these are things that seem quite simple, but are actually in the top 30 causes of disability-adjusted life years. And it seems amazing that something as simple as that is causing so much suffering. Not eating enough fruit is causing a significant amount of suffering. And this is a nice quote. I think a few of us have ended up with quotes. Gladly, nobody's used this one so far. There is no disease, bodily or mental, which adoption of vegetable diet and pure water has not infallibly mitigated wherever the experiment has been fairly tried. Debility is gradually converted into strength, disease into healthfulness. The unaccountable irrationalities of ill... Percy Shelley, the poet, from 1813, on a vindication of natural diet, where he recommended eating vegetables and not drinking alcohol, which, as Shireen said, we probably shouldn't. So he was ahead of the game. And that's it. Thank you very much.